$172,500. That's the average cost of healthcare in retirement, and it catches people completely off guard. And that number doesn't include long-term care. So I've talked to families who saved for decades and still watch 3 years of care wiped out everything they had. So if you're over 50 or you're helping a parent plan, this is the math that catches people off guard. Miss it, and a lifetime of savings can disappear in just a few years of care. So today, I'm going to be walking you through the hidden costs that blindside people as they age and what you can do now to avoid them. I'll also give you an AI prompt at the end that calculates your personal gap in 60 seconds. Stick around for that. Most people assume Medicare will handle everything once they turn 65. It won't. Medicare doesn't cover dental, doesn't cover vision, doesn't cover hearing, and the care you're most likely to need, long-term care. Medicare won't pay for that at all. The fine print is scattered across government websites and insurance documents. Nobody puts it together for you. Well, so let me do that right now. There are 8 hidden costs I want to walk you through, and each one I'll show you what it is, why it matters, and what to do about it. So let's start with the biggest, the real cost of healthcare in retirement. Fidelity's 2025 estimate shows a 65-year-old retiring today can expect to spend approximately $172,500 on healthcare costs throughout retirement. That's not worst case scenario. That's an estimate for an average retiree. And that number doesn't include long-term care. We'll get to that. So what does it include? Well, Medicare premiums, deductibles, co-pays, out-of-pocket costs for services Medicare doesn't fully cover, prescription drugs. Most people don't budget for this. They assume Medicare handles it. And here's what makes it worse. Healthcare costs often rise faster than your income. Social Security adjusts for inflation each year, but not in the same way healthcare does. That's the cost of living adjustment, or COLA. In 2026, it's 2.8%. But healthcare inflation often runs higher. Prescription drug costs, specialist visits, hospital services, they don't follow the same curve as groceries or gas. So every year, healthcare takes a bigger bite out of your fixed income. The gap compounds over time. So that's how people get squeezed, even when they did everything right. The first hidden cost is this. Healthcare in retirement costs more than most people budget for, and the gap gets wider every year. The coverage gaps nobody tells you about. Well, here's what original Medicare, that's Part A and Part B, does not cover. Dental care, routine cleanings, fillings, dentures, root canals, not covered. Vision care, routine eye exam, glasses, contact lenses, not covered. Hearing care, routine hearing tests and hearing aids, not covered. This is spelled out on the Medicare.gov. These exclusions are written into federal law. So now, some Medicare Advantage plans offer limited dental, vision, and hearing benefits, but the coverage varies widely. And according to research published in the Health Affairs, lower income beneficiaries still face significant out-of-pocket costs, even with these supplemental benefits. So the National Council on Aging puts it plainly. Having dependable dental, vision, and hearing covered is essential to staying healthy as you age, but original Medicare doesn't provide it. The second hidden cost is this. The care you assume is covered often isn't. The income trap most people don't see coming. Here's something that catches people completely off guard. Medicare premiums aren't the same for everyone. If your income crosses certain thresholds, you pay more. It's called IRMAA, an income-related monthly adjustment. And here's the trap. Medicare looks at your tax returns from 2 years ago. So if you sold a house, cashed out on a retirement account, or took a large distribution 2 years ago, 2 years before you needed Medicare, that one-time income spike can trigger higher premiums for an entire year. According to the Social Security Administration, you can appeal this with the Form SSA-44 if you had a life-changing event. But most people don't know that option exists until after they paid the higher premium. The third hidden cost is this. A financial decision you made years ago can raise your Medicare costs today. The long-term care gap. This is the one that devastates retirement savings. According to the U.S. Department of Health and Human Services, through their Administration for Community Living, someone turning 65 today has almost a 70% chance of needing some type of long-term care services in their remaining years. Women need care longer than men, on average 3.7 years compared to 2.2 years for men. And here's the critical point. Medicare does not cover long-term care. That's stated directly in Medicare.gov. Medicare does not pay for custodial care, help with bathing, dressing, eating, using the bathroom, if that's the only care you need. Medicare covers short-term skilled nursing care after a qualifying hospital stay, up to 100 days. After that, you're on your own. So what does long-term care actually cost? Well, according to the Genworth Cost of Care Survey for 2024, the national median cost for a private room in a nursing home is $127,750 per year. A semi-private room is $111,325. Assisted living runs about $70,800 per year. A home health aide costs approximately $77,800 annually. Many people need care for years. According to the Administration for Community Living, women on average 3.7 years and men on average 2.2 years. Most people don't have that saved, and most people don't have long-term care insurance. Well, the fourth hidden is this. The care you're most likely to need is a care that Medicare won't pay. Well, before I get to the cost number 5, I want to hear from you. Did you know Medicare generally doesn't cover long-term care? Yes or no? Drop it in the comments. I read them one by one. The family cost nobody talks about. Long-term care doesn't just affect the person receiving care. It affects the whole family. According to the AARP and the National Alliance for Caregiving, more than 53 million Americans provide unpaid care for an adult family member or a friend. AARP estimates the economic value of that unpaid caregiving at over $600 billion annually. But here's what that means for individual families. Lost wages, reduced hours, early retirement, depleted savings. Caregivers often sacrifice their own retirement security to care for a parent or a spouse. They leave jobs, they pass up promotions, they drain their own savings to cover gaps in care. And when it's their turn to need care, well, they have less saved. The fifth hidden cost is this. Caregiving has a price, even when no one writes a check. The Medicaid trap. Some people assume Medicaid will cover long-term care if they can't afford it. Well, Medicaid does cover long-term care, but there's a catch. To qualify for Medicaid, you have to meet strict income and asset limit. In most states, that means spending down almost everything you've saved. So in many cases, a primary home can be treated differently while you're alive, but states can pursue estate recovery after death with important protections for spouses and certain children. This is called spending down. And for many families, it means watching a lifetime of savings disappear before any help arrives. The sixth hidden cost is this. The safety net requires you to fall first. Aging in place isn't free either. Now, here's where it gets personal, because this next one affects daily life in ways people don't think about until they're living it. Many people say they want to age at home. Well, that's understandable. But aging in place has costs that people don't anticipate. Home modifications, grab bars in bathrooms, ramps for mobility, wider doorways, stair lifts. Original Medicare generally doesn't cover these. In-home help. Even part-time assistance with meals, cleaning, or personal care adds up quickly. According to the Genworth data, homemaker services now cost about the same as home health aides, around $33 to $34 nationally. There's maintenance. As you age, tasks like lawn care, home repairs, and snow removal become harder to manage yourself. Hiring help becomes necessary. The 7 hidden costs is this. Staying home isn't the same as staying free. Why timing matters for protection. If you're thinking about long-term care insurance, timing matters more than most people realize. Premiums are generally lower when you buy younger and healthier. Many experts suggest shopping in your 50s to early 60s before health conditions make coverage more expensive or harder to qualify. According to the National Council on Aging, certain health conditions can make it harder to qualify for coverage or make premiums much higher. The 8th hidden cost is this. Waiting to plan can price you out protection entirely. So what actually protects you? Well, look, this isn't about memorizing policy details. This is about knowing where the gaps are before you fall into them. The system doesn't put this together for you. Medicare has its rules, Medicaid has its rules, insurance has its rules, and none of them are designed to make your life easier. So that's what's really going on here. The costs are hidden because they're scattered, and nobody benefits from you understanding them except you. So I think about my own family when I talk about this. I think about the conversations that we had, the ones that we should have had sooner. A year from now, you'll either be glad you understood these numbers, or you'll be standing in a hospital billing office, exhausted and overwhelmed, wondering why nobody explained this to you when it mattered. So you can decide this planning isn't for you right now, but decide. Don't drift into the unprepared. Your future self is counting on the decisions you make today. So what do you do with all of this? Well, first, budget for healthcare and retirement as a real expense, not a maybe, a line item. Use the Fidelity estimate as a starting point and adjust based on your health. Second, understand what Medicare does and doesn't cover before you need care. Read the Medicare and You Handbook. It's published every year by the Centers for Medicare and Medicaid Services and available free at medicare.gov. Third, explore your options for dental, vision, and hearing coverage. If you're in Original Medicare, you may need to purchase separate coverage or consider a Medicare Advantage plan that includes these benefits. Fourth, have a plan for long-term care. That might mean long-term care insurance purchased in your 50s or early 60s when premiums are lower and you're more likely to qualify. It might mean setting aside dedicated savings. It might mean having honest conversations with family about who will provide care and how will it be paid for. Fifth, if you want to age at home, assess your home right now. What modifications would you need? What would they cost? Planning ahead is cheaper than reacting to a crisis. 6. Use AI to run scenarios that you can't calculate alone. Even if you never use AI, listen to what this calculation reveals because this is the gap most people never see coming. Well, here's a prompt that you can copy and paste in ChatGPT or Claude right now. You are a retirement healthcare cost analyst. I am, put your age in here, with your savings and put the amount in retirement saving. Using the Fidelity estimate of $172,500 for healthcare in retirement and Genworth data of $127,800 per year for nursing home care. Calculate how many years of long-term care I could afford. My projected shortfall if I need care for 3.7 years. and 3 options to close that gap. Show me the math. That is your prompt. I know it's a little bit long, and if you want a version, put in the comments, provide the prompt, and I will provide that to you. That's the math most financial advisors charge hundreds of dollars for. Now you can run it yourself. So next week, I'm breaking down one group of people who usually shouldn't buy long-term care insurance, and it's not who you think. So bookmark this video. You're going to want that prompt when you sit down to plan. The system won't do this planning for you. You have to do it yourself. You're not behind if you didn't know this. Most people don't. These costs are hidden in fine print, scattered across government websites, buried in insurance documents. But now you know what to watch for. Your health and your savings deserve protection. Plan for the real cost, not the ones you hope won't happen. And if you know someone approaching retirement who needs to see these numbers, send this to them. For more on navigating Medicare and healthcare costs as you age, I made a video breaking down original Medicare versus Medicare Advantage. And if you're not sure which path fits your situation, that's your next step. The link is in the description. So links to every source I mentioned, Fidelity, Kaiser Family Foundation, Genworth, Medicare, the Administration for Community Living, AARP, and the National Council on Aging are in the description. I'm Hanh Brown, and this is The Hanh Brown Show. I'll see you in the next one.